my name is Adrienne Walsh, and today I will be presenting my program evaluation proposal for Mission Arlington. This evaluation looks at how well key services, specifically the food pantry, rent, and utility assistance, and the free medical clinic, are meeting community needs and what outcomes they are helping to produce. Let's talk about the problem. Arlington, which is where Mission Arlington is located, is a growing city in Texas, but many residents still struggle to meet basic needs. About 13% of people in Arlington live below the poverty line, and many more fall just above it. In Tarrant County, local homeless coalitions estimate that more than 2,000 people experience homelessness on any given night. Food insecurity is also a significant concern. About 1 in 6 Texas residents are uncertain about where their next meal will come from. On top of that, around 18% of adults in the county are uninsured, which makes them more likely to delay medical care. When people put off treatment, problems become more serious and more expensive. All of this is happening while rent continues to rise and affordable housing options remain limited. For many families, even one unexpected expense can cause a financial crisis. Let's talk about Mission Arlington. So, it was founded in 1986 by Tilly Bergen. She is still working there today. I'm pretty sure she's in her 90s now, but her and her family founded it in 1986 after a missions trip to uh, Korea. So, what started as a small neighborhood outreach has grown into one of the largest faith based community service organizations in the region. They provide a wide range of supports, including a food pantry, clothing closet, furniture and household items, transportation assistance, counseling, after school programs, and a free medical and dental clinic. They also provide emergency rent and utility assistance for families in crisis. All services are completely free and supported by community donations and volunteer labor. For this evaluation, I focused on 3 programs: the rent and utility assistance, the food pantry, and the medical clinic. These 3 areas form the core of the organization's direct basic needs support. And here you can see rent and utility assistance helps families avoid eviction or utility shutoffs. The free clinic, staffed primarily by volunteer physicians and nurses, provides much needed medical and dental care to uninsured and low income residents. And this has evolved into its very own ecosystem that provides services to steer those in need towards stability and independence. Why this program matters. Mission Arlington fills gaps that government services don't always meet. Research consistently shows the importance of free clinics, especially for uninsured or underinsured people. One nationwide study found that free clinics serve as an essential safety net. Another showed that these clinics help reduce unnecessary emergency room visits and increase preventative care. For food assistance, the client choice model has shown to increase dignity and improve nutritional outcomes. What the client choice model is it's created to be like a grocery store where people can come in and pick foods off shelves versus things being stored in boxes and chosen for them and handed off. It just makes them feel like they're maintaining their autonomy and independence. When clients are allowed to choose their own groceries, they report higher satisfaction and more positive experiences overall. There is also strong evidence supporting rental assistance programs. Research has shown that even short term financial support can reduce homelessness and help families avoid eviction. Overall, Mission Arlington's model aligns closely with what past research shows is effective. It combines housing assistance, food support, and healthcare access in one interconnected system. Their faith based approach adds another layer of community connection and practical support. Evaluation design and methods. This evaluation uses both process evaluation and outcome evaluation. The process evaluation looks at how the programs operate day to day. This includes how accessible services are, how smoothly programs coordinate with each other, and how clients describe their experiences. The outcome evaluation looks at what changes occur after people receive their services. This includes whether they experience better housing stability, improved food security, or more consistent access to health care. So, some research questions I want to ask. The evaluation is guided by several questions. First, how satisfied are clients with the accessibility, quality, and coordination of Mission Arlington services? Second, how smoothly do referrals work between programs like the food pantry, the medical clinic, and rent assistance? And finally, do clients report improvements in housing stability, food security, and healthcare access over time? Okay, and quantitative measures. Quantitative data will come from Mission Arlington's records. This includes the number of clients served, the frequency of client visits, wait times, and referral patterns across programs. Short surveys will also be used. After receiving services, clients will complete a brief questionnaire rating accessibility, quality, and satisfaction on a 1 to 5 scale. These data points will help show how the programs function and how clients perceive their experiences. Qualitative data will add depth to the evaluation. This includes focus groups and interviews with clients, staff, and volunteers. These conversations provide personal insight into the experience of seeking help, what barriers clients face, and how staff and volunteers view their roles. There will also be a follow up component. 2 months after receiving services, a randomized group of clients will be contacted by phone or text to assess whether they have been able to maintain stability. All right, so the evaluation uses purposive sampling to ensure a diverse range of experiences from each major program area. The goal is to collect around 100 survey responses. Focus groups will include 6 to 8 clients per group, along with separate sessions for staff and volunteers. Quantitative data will be analyzed using descriptive statistics, while qualitative data will be analyzed through thematic coding. Comparing both data types helps identify patterns. For example, if surveys show high satisfaction, but interviews mention long wait times, the evaluation can explore why clients still feel positive overall. Strengths and limitations. There are several strengths to this evaluation design. First, it is practical and realistic for an organization like Mission Arlington. The mixed methods approach provides a well-rounded understanding by combining measurable outcomes with personal stories. And it includes both client and staff perspectives, which also helps avoid one-sided results and gives the organization a clearer picture of what is working well and what needs attention. Limitations include clients feeling hesitant to criticize a program that has helped them, which could affect the honesty of the feedback. Following up with clients can also be difficult because many people change phone numbers, move, have unstable living situations. Finally, because this is not an experimental design, it is difficult to determine causation. The evaluation can show associations, but it cannot definitively prove that the services cause the outcomes. Disseminating the findings. Sharing the results is an important part of the process. The final products will include a written report summarizing findings and recommendations. An infographic will visually highlight key statistics and quotes. Mission Arlington can present the results to staff and volunteers and also share them with donors, partner organizations, and the wider community. The information could also be included in newsletters or used for strategic planning and training. Now, for the purposes of this presentation, since it wasn't an actual evaluation that I did and was not able to collect data, an example would be if Mission Arlington finds a discrepancy between um, the long wait times, you know, maybe lower client satisfaction in some of the surveys, but whenever they fill out questionnaires, they say that they have high client satisfaction. So obviously, there is a discrepancy there, and they would want to look into why they are um, getting two different results, and look into possibly they're not wanting to be completely honest because they are receiving help, but um, Mission Arlington would want to take that into account and still try to lower their wait times, and things like that. All right, implications. Let's see here. Uh-oh. I'm so sorry. This evaluation connects Mission Arlington's mission and philosophy with real, measurable outcomes. If the data reveals gaps such as long wait times or limited coordination between programs, the findings can guide adjustments to improve services. The results can also support funding decisions. Donors and community partners often prefer programs that demonstrate positive outcomes, especially those that provide wraparound services. In conclusion, Mission Arlington continues to serve as a strong example of how community based organizations can combine faith, compassion, and data driven accountability. This evaluation offers a roadmap for understanding how their services operate and how they impact the lives of the people that they serve. Ultimately, the goal is not only to assess effectiveness, but to help strengthen the organization's impact on the Arlington community. And here are my references. And I so appreciate your time and listening to me today. I hope you have a great afternoon.